Pneumonia, an infection of the lungs. By understanding the pathophysiology of pneumonia. 1. Key concept: an infection of the lung parenchyma, the functional tissue of the lung, usually caused by microorganisms, leading to inflammation and consolidation, fluid filling the air spaces. 2. Simplified explanation: think of pneumonia as infected lungs. 2. The lung tissue becomes inflamed and filled with fluid or pus, making it difficult to breathe. 3. Mnemonic: lungs. For key aspects of pneumonia: lung infection of the parenchyma, usually by microorganism, normal function is impaired, gas exchange impaired. Symptoms develop as a result of infection and inflammation. 4. Key features: infection, microorganisms, bacteria, viruses, fungi, infect the lung tissue. Inflammation, immune response to the infection, causing inflammation and damage. Consolidation, alveoli fill with fluid, pus, and cellular debris, limiting gas exchange. Impaired gas exchange, reduced ability of the lungs to exchange O2 and CO2. 5. Main causes: bacteria, Streptococcus pneumoniae, most common; Haemophilus influenzae, Mycoplasma pneumoniae, Staphylococcus aureus; viruses, influenza, respiratory syncytial virus, RSV, adenovirus, coronavirus, fungi, pneumocystis jirovecii, PCP; aspergillus, more common in immunocompromised individuals. Aspiration, inhaling food, fluid, or stomach contents. Chemical irritants, exposure to toxic chemicals and fumes. 6. Types: community-acquired pneumonia, CAP, acquired outside of the hospital setting; hospital-acquired pneumonia, HAP, acquired during a hospital stay; aspiration pneumonia from inhaling gastric contents. 2. Clinical manifestations of pneumonia. 1. Key idea: symptoms vary based on the causative agent, age, and severity of the infection. 2. Mnemonic for pneumonia symptoms: colds, cough can be productive with mucus or dry, oxygen deficiency and shortness of breath, dyspnea; lethargy, fatigue, and malaise; dyspnea, shortness of breath. Systemic symptoms: fever, chills, and pleuritic chest pain, sharp pain that worsens with breathing. 3. Specific symptoms: bacterial pneumonia, sudden onset, high fever, productive cough, purulent, pus-filled sputum, and pleuritic chest pain. Viral pneumonia, gradual onset, milder symptoms, fever, dry cough, body aches, fatigue, and can include symptoms of upper respiratory infection. Atypical pneumonia, slower onset, dry cough, low-grade fever, and extrapulmonary symptoms, headache, muscle aches. Aspiration pneumonia, coughing, wheezing, and shortness of breath, and may lead to a fever or chest pain. 3. Diagnosis of pneumonia. 1. Key idea: diagnosis involves physical examination, imaging, and lab tests. 2. Mnemonic for diagnosis: CLAB, clinical evaluation, physical examination. Auscultation may reveal crackles or diminished breath sounds, assessing symptoms and history. Laboratory tests: blood tests, elevated white blood cell count, WBC, CRP, ESR, markers of inflammation, and blood cultures may reveal the causative organism. Sputum cultures and gram stain, to identify the causative organism. Arterial blood gas, to assess oxygenation. Bronchoscopy, to assess if there is a severe infection or if there is something else that is causing the infection, such as cancer. Imaging studies: chest X-ray, to show lung infiltrates, areas of consolidation. CT scan, may be used in complex or atypical cases. IV, management of pneumonia. 1. Key idea: treatment focuses on eradicating the infection and managing symptoms and preventing complications. 2. Mnemonic for treatment: ARES. Antibiotics, if bacterial. The main treatment specific to the identified organism. Rest, oxygen, and fluids. Supportive care to promote healing and comfort. Evaluate effectiveness of therapy. Symptomatic treatment: pain medications for chest pain, antipyretics to reduce fever, cough suppressants. 3. Additional treatments: antiviral medications for specific viral infections, antifungal medications for fungal infections, respiratory support, oxygen therapy, mechanical ventilation, pulmonary hygiene, chest physiotherapy, deep breathing exercises. Potential complications of pneumonia. Mnemonic RPs. Acute respiratory distress syndrome, RDs. Severe lung inflammation causing reduced gas exchange. Respiratory failure. The lungs can't provide sufficient oxygen to the blood or eliminate carbon dioxide effectively. Pleuritis, inflammation of the pleura, or pleural effusion, fluid accumulation in pleural space. Empyema, pus accumulation in the pleural space. Sepsis, systemic infection that can result from pneumonia. 2. Additional complications, lung abscess, bacteremia. Atelectasis, collapsed lung. Simplified explanation. 1. Infection. Microorganisms invade the lung tissue. 2. Inflammation. The immune system reacts, causing inflammation. 3. Fluid buildup. The air sacs alveoli fill with fluid or pus, making it difficult to breathe. 4. Impaired gas exchange. Difficulty in transferring oxygen into the blood and carbon dioxide out. 5. Symptoms result. Cough, fever, chest pain, and shortness of breath are the result. Professor Hammer's advice for learning pneumonia. 1. Think infection. It's primarily an infection of the lungs. 2. Know the usual suspects. Be aware of the common causative agents, bacteria, viruses, fungi. 3. Understand the symptoms. Recognize key symptoms like cough, fever, chest pain, and dyspnea. 4. Recognize the signs. Be aware of the signs on physical examination such as crackles or decreased breath sounds. 5. Focus on treatment, antibiotics for bacteria, antivirals for viruses, and supportive care for all. In summary, pneumonia is an infection of the lung parenchyma, typically caused by microorganisms, leading to inflammation, consolidation, and impaired gas exchange. Knowing the causative organisms, understanding the presenting symptoms, and the appropriate treatment strategies is key for managing pneumonia effectively.